Let's get more now on the coronavirus pandemic. The authorities in the Indian capital Delhi have said they'll impose a weekend curfew. Let's speak to our correspondent in Mumbai, Yogita Limai. How will this curfew work? What are the terms of it, Yogita?
So what the Delhi government has just announced is they're basically telling people in the city, do not go out over the weekend unless it's for essential needs like buying food or medicines, or unless there's an emergency happening. At the moment, there isn't clarity about what this means for establishments that currently are open, like restaurants, for example, or shops which are selling non-essential items. But what the minister said in his press conference was that it would be a curfew. People are being told do not go out unless it's for essential needs. They've also announced that people working in government should be working from home unless they're engaged in essential services, and that's why they have to be at the office. As far as private offices are concerned, they've said they have to operate at 50% capacity. This is in addition to restrictions that have already been in place in Delhi. So restaurants, for example, can only operate even now at 50% capacity. Cinema halls have been closed, auditoriums, banquet halls, sports complexes, these have been closed for a few days now. Here in Mumbai, where I am, which is the worst affected city at the moment as well, we have a night curfew in place. Restaurants, again, are only allowed to operate at 50% capacity. We've had civic authorities here say that if they see the number of hospital admissions going up very rapidly, they will also consider putting in further and more stringent restrictions.
And on that point, Yogita, how bad have things got there in terms of this wave of COVID?
Well, what we know is it's spreading very rapidly. I mean, literally every day, among my own friends in this city, I'm hearing of people getting infected. The doctors I've been speaking to also saying they're seeing a massive surge in infections. Doctors at both private as well as government hospitals have been telling me that hospital admissions are going up, including people who need oxygen. At the moment, however, about 85% of hospital beds that are available in the city to treat COVID patients, those are vacant. So what doctors are saying is that this does whichever variant is causing this, and we can't say with certainty at the moment which one it is, because not every sample that tests positive is also tested for what kind of variant it would be. But experts are saying that when you do a random sequencing, a majority of those are being identified as Omicron. So doctors are saying that the infections this time around do seem to be mild, and a smaller percentage of people are needing hospital care. But if the volumes are large, they say that medical healthcare systems could be overwhelmed very quickly. And so they are warning people to stay vigilant, to wear masks and to socially distance.
OK, Yogita, thank you very much for the moment. Yogita Limai there for us in Mumbai.